Negotiations to broker a ceasefire deal in Gaza are taking place in Doha, with reports Hamas has supplied a list of 34 hostages it says it will be released as part of the deal. The humanitarian situation in Gaza continues to deteriorate, and hospitals are struggling to cope with the frequency of mass casualty events. Dr. Saira Hussain spent a month volunteering with Medical Aid for Palestinians in Nasser Hospital in South Gaza between October and November of last year. She's back in Australia and joins us now to recall her experiences from the wards. Thank you for joining us. Perhaps tell us first why you wanted to go to Gaza.
I was very moved by the events that I saw unfolding on the TV back in October, and I have some experience in the humanitarian sector, and I felt I had the skills and I had the time and the ability to go. So I felt that it was my duty to do what I could. Yeah, you're an anaesthetist. How prepared were you before you went for what you saw there? I had discussed the situation with colleagues who were on the ground there. I followed all the major non-governmental organisations. I was very much in touch with the World Health Organization reports, and I felt clinically I was able to deal with what I was about to face there, which was obviously never going to be the case because it's a very unique situation. I also made an effort to learn the Arabic language to better understand the patients and understand my colleagues. Wow. What was your first week like? Our first week was actually fairly quiet in terms of, as you say, mass casualty events, but that actually gave us the opportunity, my team and myself, the opportunity to address one of the major issues that is often not talked about, and that's the problem of the chronic health disease burden on the population of Gaza, because that hasn't stopped. And when I say that, what I mean is the things like cancers or ischemic heart disease or diabetes. So we actually had a good 4 or 5 days addressing, for example, colorectal cancers, gynecological cancers that were at a very advanced stage. And the sad thing about this was that although we could perform the surgical part of the procedure for managing the cancer, there's very limited, almost no chemotherapy and no radiotherapy. There isn't radiotherapy in Gaza, full stop, and there hasn't been. So you can only provide treatment for certain cancers up to a point. The other issue is that we were also performing procedures on small children for example, something called a decortication, which is where you remove part of diseased lung. And that lung has become diseased because they have developed a cough or a cold, which has not been treated appropriately with antibiotics and has got worse over time, to the point where the lung actually becomes damaged and part of the diseased lung actually has to be removed. And we did quite a few of those operations on children as young as 4.
And all the while, there's a war raging outside. What was it like when you did get those mass casualty events coming in?
It was absolute chaos because the infrastructure, the roads are non-existent. So people would turn up on horse-drawn carts, being pushed along on whatever kind of implement with wheels that they would have. And, you know, not only would the patients come, their relatives or accompanying people would come. So you'd have a huge amount of people in a very small place, and you're trying to direct your attentions to critically ill patients, the majority of which were women and children. And my hat goes off to the local staff there, because they manage all of this very well. And as I say, they manage this before the team, our international teams go in, and they manage them after we leave. I mean, you do what you can with resources that you have, and you remember that resources are limited. They are sporadic. They are sometimes not fit for purpose. I had a number of occasions where medications didn't work, probably because of the inability to store them properly, because of the electricity electricity supply gets interrupted. And one of the other important things I think to mention is my local colleagues, the doctors, nurses, allied health workers, pharmacists, cleaners, anybody else who provides service in a healthcare area, at the end of their shift, when they go home, if they get home, as we know, there is a targeting of healthcare workers. If they actually reach home, their home, it's often a very flimsy shelter, a tent, which is totally unsuitable for the weather that Gaza is facing these days. And then they come back to work the next day to do it all again.
What were your conditions like? I mean, presumably as an international aid worker, you do have access to some of the things that the Gazan people don't, you know, a reliable food source and somewhere to stay.
When I was there, we had a reliable food source and we had a place to stay. It's like a bunk room, separated for male and female. Just before our team left at end of November, the bakeries was starting to become non-functional because of the lack of flour getting in. And the usual one meal a day that the hospital would supply for people working in there, that was becoming a little bit more sporadic as well, as was availability of food in the markets.
Did you ever feel frightened?
On occasion when you would hear an explosion that sounded very, very close. Usually you'd feel it, and those are the ones that would make you sit up. And, you know, we were in the humanitarian zone, so it all felt a little bit close for comfort, even being in the humanitarian zone, which, as we know, is being relentlessly bombed. Would
you go back?
Definitely.
All right. Thank you very much for talking to us and sharing your experiences of the Nasser hospital in Gaza. Dr. Saira Hussain, thank you.
Thank you.